And staying with health news, Breast Cancer Awareness Month, observed every year in October, served as an opportunity to educate the public about the disease. Joining us in the studio today to discuss more is Dr. Annett Al Hamadi, who's a consultant, general and breast surgeon in the Mediclinic City Hospital. Hello, doctor.
Good evening. How are you?
It's a pleasure to have you here joining us today. Well, doctor, I wanted to discuss about that health experts say that 1 out of 8 women will most likely be diagnosed with breast cancer. So from your perspective, doctor, what are the causes of breast cancer?
We don't know so much about what causes the breast cancer for a single woman. We are all on risk to get breast cancer. We know certain risk factors like family history of breast cancer or ovarian cancer, smoking, obesity, unhealthy lifestyle, not exercising. So these can cause breast cancer. But for the individual to say this was the reason why you got breast cancer is impossible to tell.
And what about the treatment options available when it comes to breast cancer?
So in general, we look at having surgery, we are looking at having medical treatment and having radiotherapy. So this is the mainstay of breast cancer treatment.
I'm sure that could benefit a lot of women that are going through this phase. And what is the change that we're experiencing here within the surgical landscape as of over the years?
As we treat breast cancer as a multi-modality, you will always have many doctors looking after you. So it's a team approach. And in all these different areas, we see a lot of innovation. So things are changing for the better of the patient. We have better outcomes and we have lesser side effects of our treatments. From the medical oncology side, from the radiotherapy side, and as from the surgical side. So it is always easy to do more, but we surgeons have learned to do less for our patients. So smaller surgeries. We use chemotherapy before our operations to shrink the tumor, to remove less in the breast, to operate less aggressive in the armpit, and to give our patients the same outcome or even a better one cosmetically. And we do less harm to them, so we have less side effects of our treatment. And I believe that maybe in a few years we will have breast cancer treatment even without surgeries. Not for all of them, but for a few of our patients.
Wonderful, wonderful. And finally, coming to our last question, how important do you think when it comes to the family support when we're curing the breast cancer?
Well, it starts from the beginning. It is important that even husbands or fathers or children take their moms, take their aunties for breast cancer screening. So it is vital that we diagnose breast cancer early with a mammogram, for instance, so before it is an advanced cancer, because it's then easier to treat and the survival chances are better. During the treatment, it is very important that you have the support from family, from friends, from the workplace, and even survivors. We very often hear that when women had breast cancer, you look very good, everything is over, so go on with your life. But they might be still taking medicine, they still suffer emotionally from the change of their body, from the side effects of the treatment. So survivors still need support from every side of family and community.
Wonderful answer, doctor. So thank you, doctor, for actually being with us here today.